Hello, let us learn how to interpret overhead squat assessment when the feet turns out. So in my previous video, you had learned how to set up an overhead squat assessment and its common interpretation. So here we will go in detail. So interpretation is very important. Without a proper interpretation, it will become very difficult to find the effective manner or the corrective exercises which can be designed for your client. The easiest way to interpret your findings is through our overhead squat solution table, which we will be discussing later in this video. So before we begin, you should be knowing some major considerations. First thing is overhead squat assessment is not a diagnostic tool, which means it does not help us in diagnosing any specific issues or injuries. Rather, it will guide us if there is any potential problem that can lead to any risk of injury, and it will help us to improve the movement pattern. Next, you should be knowing two most common terminologies, that is the overactive or a shortened muscle and what is an underactive muscle. So overactive or a shortened muscles are those that are commonly referred to as tight. This leads to a reduction of motion at certain joints. Underactive muscles are those that tend to have a decreased neural drive. In other words, they are not being activated for any number of reasons, leading to a lack of tension through them. So this is the overhead squat solution table where most common compensations are listed out. So here they have listed out around 7 compensation along with the muscles which get overactive, underactive, and their corrective exercise strategies. So these are just the sample which we will be discussing. So first let us find out what is the reason for the feet turnout. So it is said the most common reason is number one is tibial external rotation. So here in this picture you can see how the tibia externally rotates, and second, why the tibial external rotation is happening is because of restricted ankle dorsiflexion. So ankle dorsiflexion is the movement happening in the sagittal plane. Whenever the movement is restricted in the sagittal plane, it steals the movement from the transverse plane. So the feet turn out in the transverse plane. So now which muscles are responsible for this? The first thing is the soleus. The soleus, when the soleus is very tight, it results in restricted ankle dorsiflexion. Next, the muscles responsible for the tibial external rotation. The first muscle is the lateral head of the gastrocnemius. So lateral head of the gastrocnemius, when it is overactivated, it leads to the external rotation of the tibia. Next, the second muscle is the biceps femoris. The biceps femoris, when overactivated, leads to the external rotation of the tibia. Okay, mainly the short head of the biceps femoris. And the underactive muscles are your medial head of your gastrocnemius and the medial hamstring complex. So these two muscles are your internal rotators of the tibia. Along with this, you have three other muscles, which is your gracilis, sartorius, and popliteus. So remember, sartorius is the longest muscle in the body. So I'll repeat it again. The overactive muscles being the soleus, lateral head of gastrocnemius, short head of biceps femoris. The underactive muscles are the medial head of gastrocnemius, medial hamstring, gracilis, sartorius, and popliteus. So the corrective exercise strategies adopted for this is foam rolling, static stretch, and activation of the underactive muscle. So foam rolling. Foam rolling can be done for the calf muscle as well as the hamstring muscles. Next, the soleus stretch. It is very simple, where you stand near a wall with both the knees bent and push your body weight onto the wall. So this will help you to get a soleus stretch on the leg which is placed behind, and you can hold this stretch for 10 to 15 seconds and repeat it 3 to 5 times. Next is a gastrocnemius stretch. It is quite similar to soleus, but the only difference is the leg which is behind the knee should be extended. Okay, as gastrocnemius is a two joint muscle, The knee should be extended and ankle should be dorsiflexed to feel a good stretch over the lower heel as well as the upper part of the calf. So to isolate the gastrocnemius stretch to the lateral head of the gastrocnemius, you need to lift the medial aspect of the sole of the feet a little up to feel the stretch over the lateral head of the gastrocnemius. Next, the biceps femoris stretch. This is the stretch for the lateral hamstring group. It is very simple. Lie down supine, bend your hip and knee to 90°, internally rotate and adduct it and stabilize it with the opposite hand by placing it on the lateral aspect of the knee. Next, extend the knee to feel the stretch over the lateral aspect of the hamstring. So repeat this for 15 to 20, hold the stretch for 15 to 20 seconds and repeat it 3 to 5 times. Next is to activate the tibial internal rotators. So your tibial internal rotators are your popliteus, medial gastrocnemius, medial hamstring, gracilis and sartorius. So this exercise is very simple. You need to sit on a couch or a chair where the knee is bent to 90° and adduct your feet, which is causing internal rotation of your tibia. So make sure the knee is stabilized. If the knee is not stabilized, internal rotation will happen at the hip joint, which is not correct. So make sure the knee is stabilized and the internal rotation is happening only at the feet. Next, okay, it is also said that the tibialis anterior and the tibialis posterior muscle become underactive. In such cases, you need to do the activation exercises for the tibialis anterior and posterior. So to activate the tibialis anterior muscle, you need to dorsiflex your ankle and invert it, and you can do this with a TheraBand. Hold it for 10 seconds and repeat it for 10 to 15 times initially, and then you can progress accordingly. Next, activation exercise for the tibialis posterior is plantar flexion and eversion. Next, this is the integrated strengthening exercises, which is the single leg balance reach. Stand on one foot and reach out with the other leg in multiple planes. So you can reach out sideways, forwards, backwards. Okay, so this helps to strengthen up the muscles in the leg as well as increases the ankle stability. And next, when there is an restricted ankle dorsiflexion, you can do this simple mobility exercises that will help to increase the ankle dorsiflexion. So the procedure is place the feet on the stool, okay, and tie a TheraBand in the front of the ankle and tie it behind the body. Now propel your body forwards, causing the ankle dorsiflexion. This is a very good exercise to improve the ankle dorsiflexion. So here we are done with the first compensation, which can be caused when doing overhead squat assessment and how to do the corrective exercise strategies. Thank you.